Hello, everybody. So I mainly wanted to come on today and just give a little bit of an educational video, I guess, because this has been something I've been dealing with for close to a year now. We're like close to a year. And I find that I haven't come across a lot of videos on this condition or the ramifications of this condition. So I thought I would come on and share my experience a bit. And for anybody who is facing the same kind of a diagnosis or same kind of situation, or who is going through it, to kind of give you a little bit of a I guess just a little bit of an education, a little bit of teaching on the problem. So my condition, basically what I was diagnosed with last July is called a cholesteatoma. There, I said it right. It's a big word, cholesteatoma. What a cholesteatoma is basically, it's a cyst that's developed deep in your inner ear, basically it's caused because your eardrum kind of gets a problem and your eardrum doesn't function right, and then instead of going in and out a certain way, it goes in, it moves a certain other way. And then dry skin develops around it. The dry skin evolves, it becomes a cyst, and then you got a problem. Let me just share briefly what led to this. I've always had problems with wax in my ear, so quite often I can get wax build up, and I know when I have it. And so I make an appointment with my family doctor to go get it looked at, and the family doctor will, your family doctor just basically will take water and squirt it in your ear, a whole bunch of it, and then have your head tipped that way, and it comes back out, brings wax out with it. So he did that for both my ears, my right and my left. But the problem was my right kind of started to clear up. Okay, you got that feeling where you could hear right out of it. But my left ear just still felt clogged. It just didn't feel right. And so I went back to my family doctor a couple of times because it just didn't feel right. And the family doctor, no offense against them, but they can only see so far inside your ear with the tools they have. They can't see deep into your ear with the tools they have. So he could tell there was an infection in there in my left ear, but that's all he could see, so he put me on ear drops. And so I went through a round of ear drops. I went through a round of them, still didn't seem cleared out. I kept going like this with my nose because I'm like, I can't hear out of it. It's still clogged. So I went through another round of ear drops, and then I started to develop better symptoms. It wasn't just clogged. I was starting, I would bend down and I would get dizzy. Just bending down really wasn't a problem standing up at that point. But then on July 4th last year, I went to bed that night, and I really felt like I felt like my bed was spinning a lot of the night. Like, just even laying on my bed felt like it was spinning. And throughout the night, and during the night, I guess it was the early morning, it was maybe about 4 or 5 in the morning, I went up and used the washroom. I literally thought I was going to faint because everything was spinning all around me so violently. And I basically just became immobilized. I sat on the floor, just crouched on the floor, immobilized, okay? I was afraid to stand up. My wife was beside me, and she was trying to comfort me. But things were still spinning very violently, very, very, very viciously, and then things were spinning so much, my stomach was doing turns, and I knew I felt like I had to throw up, but I was afraid to stand up to make it to the washroom, so I didn't even make it to the washroom. I just threw up right on the floor, at that point, I was waiting for an ambulance. I had called an ambulance because I knew things just weren't right. There was something terribly wrong here. I did not know at that time what was going on in my ear, obviously. But I just want to urge everybody who, first and foremost, with anything with your health, I want to urge everybody, if you really don't feel right, if you know there's something terribly off, something not right, do not hesitate to reach out. And that's what I did. I was like, I had never called an ambulance in my life before, but I was like, I need to call the ambulance. I need to go to the hospital. Something is not right here. It took a while for the ambulance to get here, actually. I guess I wasn't a high priority. But they took me off to the hospital. And yes, emergency can be backed up. Emergency was very backed up that day when I had to wait a while in the emergency room. They had put me in a wheelchair, which was good. And, I kind of had to learn how to wheel myself a little bit. If I had to use the bathroom or whatever, I had to wheel myself over there. But when they took me in, the first thing they did was they took blood from me. Then they hooked an IV into my arm. And then they had me lay down and they moved me around on the bed. That wasn't very fun. They moved me around in different positions. And because, I was almost blacking out then, fainting. I was so dizzy. And then they did what was called a CAT scan. So they did a CAT scan, a complete head CAT scan as well, in the emergency. And I had to wait a while for that to come back. But this is how a cholesteatoma is diagnosed, really, if you're fighting an infection, that will show in your blood. But obviously the biggest marker is the CAT scan because it shows everything there. And the CAT scan showed the ear, showed above the ear, and showed just this large circle of fluid on the CAT scan. So that's what they told me. They said to me that there was a lot of fluid buildup in there. That's all they told me. And then I had to wait for an ENT specialist to come see me. So when the ENT specialist came and saw me, they explained to me exactly what was going on. They took me to this one room where they have these deep cleaning, it's like a little vacuum cleaner that goes in your ear. And it wasn't very fun, but not very... It was so much fluid in there that it did not feel good when they stuck that in and started sucking stuff out of my ear. But yeah, that's when they can find that out, and then they basically, there's a camera too. You can see your ear. I only looked at it the once, but I said, is that what all the stuff that's in my ear? It's no wonder I'm feeling so off. So this is a cholesteatoma, and many times it's caused by a virus or a bacteria. It usually is something that feeds it, kind of gives it its energy, and that's what was with me, because they also had found out through another test in the hospital that I had MRSA. MRSA is methicillin-resistant Staphylococcus aureus. It's a pretty serious disease. It's pretty common, but it's also can be very serious too. It can be life-threatening at times. And actually, as I said, go to the hospital if you know something's off, because that was the best decision I made, because I was in pretty serious condition. And, the nurse actually told me that I had gone just in time to the hospital to get this looked at. So what happens from here? So you get diagnosed with a cholesteatoma. Well, they admitted me into the hospital because I had to have IV antibiotics. I literally couldn't stand on my 2 feet without any kind of assistance, so I could not really go home. And then the next day they did a hearing test on me, because this is a part of the problem that happened with the cholesteatoma too. There was so much infection and so much disease in my ear that it's basically wrecked the bones in my ear at that point. And so they did a hearing test, and I'm deaf in that ear now. I was deaf when they did the test too. Like, a cholesteatoma just wrecked all the hearing in my ear. So the next day, I was very fortunate to get great care. I am very grateful for the medical care I got in the hospital. I really am. They took really good care of me, and they referred me to an amazing ENT doctor/surgeon. So I saw him the next day after I had my hearing test. I was actually at one hospital here in the city, and he works out of the other hospital, so he came over to this hospital to see me, looked at my ear, and basically confirmed everything else that the nurses had already said to me. So basically what needs to happen at this point in the journey is you're looking at a surgery, because they have to go in and get the cyst out, and there's no other way to do it other than surgery, and that surgery is called a mastoidectomy. And so let me just talk a little bit about that for anybody who has cholesteatoma, what to expect with this, and then your recovery quickly, okay? So, and for me, I had 2 surgeries because it was so badly infected. I had one just 3 days after I went in the hospital, and that was like a shorter surgery. Basically, they just went in, took out the most dangerous part of the cyst, had to keep giving me antibiotics, had to keep having me put medicine in my ear to clear the infection up to a point where they could go in safely. And they went in, I guess it was a little over 3 months later. They went in to do a more deeper surgery to basically clean everything out, make sure every part of the disease part of the ear is out, and so that this will never happen again. And that's what I was told. What they did with the second surgery is this will never happen again. But let me give you a general idea of what to expect in surgery, okay? So what they do in both surgeries is very common. It's basically the same. Both surgeries, they put you under completely. They take a scalpel and they cut an incision right behind your ear here to open up your ear. And then once they open up the ear, what they do is they got a little tool, a little protractor, and the little protractor will extends out and it keeps the ear open, kind of keeps the ear like this so it's wide open. And then what they will do, with my first surgery, what they did is they just snipped out the most dangerous part of the cyst so that there would be no danger of any of the fluid leaking up to my brain. And the mastoid, it's called a mastoidectomy because it's a mastoid bone back there. It's basically a porous bone. It's kind of a honeycomb structure. But they have to cut into that, and they have to take a lot of that out because it's just they have to drill it down. Basically, that's what they do. They open up your ear, take out the cyst, drill down the mastoid to get diseased part out. So that's what you can expect in surgery, that kind of a thing. And then what they do is they, once they're done, they put your ear back in place, and they, for me anyway, they put a bunch of staples behind the ear to suture it back together. And then you have a post-op about a week later, and the stitches usually come out a week later as long as everything is healing fine. But I've had a hard road with it. I definitely have. It hasn't been easy because it got reinfected both times after my surgery. They had to give me, I still put it in once a week too, a powder that goes into your ear, and it dries your ear out. It kind of clears up any infection that might be there, and it helps your ear heal. But anyway, that's what a mastoidectomy is. That's what you can expect. And my second surgery was a mastoidectomy too, 3 months later. But it was called a radical wall down mastoidectomy. So it's a pretty serious surgery. It's not like the first one where it's a lot more, it's not like the first one where it's pretty straightforward and short. I believe my second surgery was about 3 hours, if not a little more. And what they do, the principles are still the same. They make an incision behind the ear. They open up your ear with a protractor. But for this one, they actually kind of reconstructed the ear. So what they did in the second one was what they do is they go in, do more drilling down with the mastoid bone, okay? But for the second surgery, they also took out part of the ear canal. That's why it's called wall down. They put your wall basically doesn't exist at that point after the surgery. So what they do is they make a big, large cavity in your ear. So it's kind of like wide open your ear. But it's not a pleasant surgery. And I won't lie about that. I'm not going to hide the truth about that. It wasn't a pleasant surgery. Recovery time is a pain in the butt. It takes a while. For me, I know my first surgery, it took a little over 2 months to get back to work. And my second surgery, I was off close to 3 months. And the second surgery, as I said, is a lot more detailed than the first. When they're taking part of your ear canal out. And it can be a bit of a mess. And I'm not going to hide back on that truth too. I want this to be an honest video of what to expect. So, because your ear is so close to your head, and of course, that's the idea of blood, right? Blood goes right up to your head. So, there's more blood in that area. So, there definitely, you got a lot more bleeding that happens with this surgery. And you have gauzes that are held in place by like a cup on your ear. But you have to change those gauzes quite often. And even, I think for a good 2 weeks after my surgery, I still had a little bit of blood leaking out of my ear. Not like major, but it was just mixed in with other fluid, and it was kind of just, constantly leaking out of my ear. So that's what you can kind of expect. It is a hard road. And it's not exactly something, I don't think I'd want to, I wouldn't want to, it's not something that's necessarily fun to sign up for, but it's something that has to be done. And basically, that's what had to be done, because you have to get that out. If you don't do anything with it, there's a tremendous risk of it moving up your ear to your head to your brain, and if it gets up to your brain, you're in serious trouble. So I'm very grateful for my surgeon. He's an amazing surgeon. He's taken really good care of me. He's done a fantastic job, but it's been a hard road for sure. And if you get diagnosed with something like this, as serious as mine is, you can expect a long road. You can expect to be off work for a while. And I think another huge thing in the recovery that you have to be aware of is the dizziness and the vertigo. I had that quite bad. So yeah, I mean, I went into the hospital with the dizziness, right? And you kind of, you're getting a surgery and you're kind of thinking, hey, like this is going to solve all my problems. No more dizziness. But no, I'm okay now. But after your surgery, the dizziness can be quite bad at times. And I know after my second surgery, especially, I had it was pretty rough. I mean, I tried to go out driving, I think 2.5 weeks after my surgery. Horrible mistake. And I was going somewhere with my wife. My wife does not drive. We got kind of like, I guess, a halfway there in the city. And it was just like, I was feeling like I could black out. I was really dizzy, not feeling very well at all. And it was horrible. And I didn't really know what to do. I had no choice but to, I pulled over, sat somewhere for a little bit of time. But I still didn't take it away. And, I had to drive back home. So yeah, horrible. And I think, it took at least a couple months for me to feel really comfortable driving again. If I was inside, things were not as bad. I could manage to get around fairly well inside. But the minute I stepped outside, everything was spinning again. Everything was dizzy. I couldn't walk anywhere without assistance outside for a good, again, I'd say a good, basically a good month and a half. I was given a walker, which was great. A walker was a great tool because I went outside a lot for walks with it, and I felt safe with it. And the more I walked with it, the more confident I felt, and the more I actually leaned on it less. So that was a great tool. But this is this is an education video kind of to explain things to you, hopefully. To know if you get a cholesteatoma, what that is, what you can expect from it, what the surgery is like. And so I just wanted to kind of educate people on that. And also just, please, just, if you feel the way I did at first, just don't hesitate. Just, get yourself looked at. Because I had been to my family doctor a couple of times. It hadn't cleared up and it gotten worse. And so you have to do what you have to do. But that's basically what a cholesteatoma is. And the surgery to correct it is a mastoidectomy. Now, I had it pretty serious. And there's no disguising that. And basically, I want to say that there are some people that don't have to have the wall down procedure. They have wall up, so the canal wall stays in place. But wall down is a lot more, it's a pretty serious surgery that knocks you out on your feet for a bit. But the good news with the wall down, at least in my with me, what I've been told is I will never get a cyst in the ear again because it's so open. The cyst has nowhere to hide, nowhere to form. So that's a great thing. No more surgeries. That's what you want to hear. But, you know, it's a lifetime monitoring now. That's the problem. Like, you're going to have to go, you have to go to the doctor now, the ear ENT doctor, and occasionally get your ear cleaned out, because the problem is the ear doesn't cleanse itself like it should now, because it's a big, large, open space now. So, but you get used to that. You know, the more you go, that little thing, the little suction thing that goes in your ear to clean your ear out gets more and more tolerable, and you kind of get used to it. But I've been told that I'll probably get to a point where I only have to go a couple times a year to get that done. So, but that is kind of what you can expect with this condition, a cholesteatoma and a mastoidectomy. And you can only hope that if you get it, I just hope that everybody here can get connected with a great ENT doctor and a great ENT surgeon that can get it fixed for you and get you kind of living as normally as you can. Now, for me, I'm deaf in that ear now, right, as I said. So I have to get used to hearing out of one ear, which is kind of a huge adjustment. But there are possibilities down the road, and I'm even going to ask about them at my next appointment. They had mentioned a hearing aid, and I'm going to see if that would be any kind of help for that ear. But the thing I've been told more than anything that probably would be the most major help is called a cochlear implant. So what that is it's another surgery, which kind of sucks. But what they do is they open up your ear again, and they're not taking anything out this time, but what they're doing is they're putting in a thing that hooks up, kind of like a transmitter that hooks up to that part of your ear. And then there's a part of it that's up here higher on the outside, and it's got a microphone on it, and they set it up for you eventually. And what eventually, if what I've told happens, is the sound goes through there, it comes into here, the sound gets communicated into your ear up to your brain, and then all of a sudden you can hear out of that ear, right? So, but anyway, right now I'm just kind of learning to live with one ear for the time being. So, but I hope you found that educational and informational, and yeah, I just want to share that with people, what to expect with this condition. So thank you for watching, and please, if you have any comments or questions, I'll try to answer them for you as well. But this is what to expect with a cholesteatoma and the surgery after, okay? So I hope you found that educational. Thank you.